Tonight, we're continuing to examine healthcare across the Tri-Cities. In a News 5 Your Voice, Your Future town hall last year, many in attendance raised concerns about the state of healthcare in the region. Here's News 5's Kristen Kwan.
Hospital emergency rooms across the nation are still trying to recover from the COVID-19 pandemic. In part 3 of our special report, we're looking at how Ballad Health's ERs were impacted by the COVID-19 pandemic and what's being done to address the problem of people waiting hours for care. Many people prefer to believe the COVID-19 pandemic is a thing of the past, but for the nation's hospitals, the effects have yet to fully fade. Staffing shortages and employee burnout are still major concerns.
It was obviously a very tumultuous time for the health system.
According to a survey by the National Council of State Boards of Nursing, 100,000 nurses in the U.S. left the workplace due to the stresses of the pandemic. Ballad Health was not immune. Dr. Clay Runnels is Ballad's chief physician executive and served in the ER during the pandemic. He says when nurses and physicians left, it created a big problem for the hospital.
One of the things that people don't really understand is that ER wait times are not usually related to the ER.
Dr. Runnels says while the hospital may have beds available, they might not have the staff to care for those patients.
When staffed beds are down, then you can't transfer the admitted patients out of the emergency department, and everything backs up into the emergency department and backs up into the waiting room.
Dr. Runnels believes that the merger between our region's two healthcare systems that created Ballad helped save lives.
I really don't know how we would have done it if we weren't a merged system, because it seemed like every day there was a shortage somewhere of some resource that we needed, whether it be oxygen or ventilators or staff with certain skill sets.
And while COVID made things extremely difficult, he says Ballad was actually better prepared.
So we were able during that time to effectively move those resources around the system as needed because of being one health system. And I think in many ways we outperformed a lot of other health systems with regard to how we cared for our patient population in the region because of that.
Neil Osborne is a city council member in Bristol, Virginia. He's also a type 1 diabetic and has seen emergency room wait times firsthand.
I was going into DKA, which is diabetic ketoacidosis. My sugar was about 500, so my body was essentially shutting down. So I went to the Bristol hospital. I was there probably at, I'll say 10:30 or 11, and got put in a wheelchair, and I kind of went downhill throughout the day while I waited in the ER, in the emergency room. You know, first I was throwing up, then I was throwing up bile, then I was throwing up blood. And at some points I was passed out, I was unconscious. It was about 12 hours, 10 or 12 hours in the ER waiting room before I got to a room in the ER. Then it was overnight and into the next day, late morning, early afternoon, before I ever got moved out of the ER. So, you know, it was about a 30-hour process.
How do you feel about health care in the Tri-Cities?
We're fortunate that we have the hospitals, but the quality of care has not lived up to what Ballad promised it would be, and really to what the citizens deserve in our area. Just because we're in a rural area, just because we have, you know, a lower median income than other parts of the country, doesn't mean we don't deserve access to the same quality health care.
Newly released figures by the Centers for Medicare and Medicaid Services says the median time patients spent in emergency rooms in Virginia and Tennessee was around 2 hours and 40 minutes nationwide. CEO and president of Ballad Health, Alan Levine, points to data that says Ballad hospitals are performing better than or close to the national average when it comes to several metrics. That includes the percentage of patients who leave the ER before being seen. At Ballad's Johnson City Medical Center and Holston Valley Medical Center in Kingsport, 1% of people left before being helped. The national average is 3%. Levine also points to data that shows they far exceed other Tennessee hospitals and the national average when it comes to treating patients in the ER with stroke symptoms. 100% of Ballad patients receive brain scan results within 45 minutes. Levine says they also recently raised pay from $18.50 to $32 per hour for new RNs in order to keep nurses staffed in Ballad hospitals, which he says will hopefully increase quality of care.
So as we hire more nurses and retain more, we're digging our way out of this. And you can see it in our quality data, and you can see it in our ER performance. That like, as I showed you with the quality data, we were doing well. And then 2021, 2022, we tanked, just like everybody else. And there's a lot of support for that. You can Google. I mean, this didn't just happen to us. But then you can see, and if you look at our nursing turnover trends, you can see as our nursing turnover came back down, our quality measures started improving. And so there's a direct correlation between nurse staffing and quality of care.
But according to the U.S. Bureau of Labor Statistics, Ballad's $32 an hour is lower than the national average of $39. And Osborne says we have to do better.
The pay is a problem, and I know they've taken steps to discuss that and address it, but I don't know that it's gone far enough.
There's not just a nursing shortage, but there's also a big shortage of doctors. In tomorrow's report, we hear from a man who says his wife desperately needed a specific type of doctor.
Yeah, she had a lot of life left to live, I think, and now it's gone.
That story tomorrow on News 5 at 6.